How are symptom rating scales used in ADHD assessments? Have you ever wondered how professionals assess attention deficit hyperactivity disorder? One of the key tools they use is symptom rating scales. These are standardized questionnaires designed to evaluate the presence and severity of symptoms related to ADHD. They play a vital role in the diagnostic process by providing structured information about behaviors like inattention, hyperactivity, and impulsivity. Symptom rating scales help clinicians gather consistent data from various sources. This can include self-reports from the individual, as well as input from parents, teachers, or other observers. The age of the person being assessed often determines who provides this information. At their core, these scales list specific behaviors linked to ADHD. Respondents rate how often they experience these behaviors over a recent time frame, typically the past 6 months. For instance, questions might ask how frequently someone has trouble sustaining attention or acts impulsively. The responses are scored numerically, allowing clinicians to quantify the severity of symptoms and compare them to established diagnostic criteria. Different scales are tailored for different age groups. For children, the Vanderbilt ADHD Diagnostic Rating Scale is commonly used. This scale collects feedback from both parents and teachers, capturing behaviors in both home and school environments. This multi-informant approach helps identify consistent symptom patterns and any related issues, such as anxiety or oppositional behavior. For adults, the Adult ADHD Self-Report Scale offers a self-administered questionnaire that reflects how ADHD symptoms can manifest in adulthood. This scale aligns with diagnostic manuals like the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It includes items that assess attention difficulties, impulsivity, and hyperactivity tailored to adult experiences. Adults typically rate their symptoms on a scale, indicating frequency from never to very often. Clinically, symptom rating scales are not used in isolation to diagnose ADHD. They are part of a broader assessment process. Clinicians use these scales to identify symptom patterns that may require further evaluation. This can include interviews, medical history reviews, and sometimes additional psychological testing. Rating scales also help differentiate between ADHD subtypes, such as predominantly inattentive or combined presentations, by highlighting which symptom clusters are most noticeable. In practical terms, these scales improve communication between patients, families, and healthcare providers. They provide a common framework to discuss symptoms and support monitoring changes over time. This is particularly useful for evaluating how effective treatment is. In summary, symptom rating scales in ADHD assessments are structured tools that quantify the frequency and severity of ADHD-related behaviors across different settings and age groups. They provide essential information that complements clinical judgment and other diagnostic methods, helping to form a thorough understanding of an individual's ADHD symptoms.